Hello and welcome to another video on the most important blood test to be done to track your metabolic health. Many of you might be doing a few of these tests in your annual health checkup, and some of you might be here just for the curiosity on which test can be done. When my patients, friends, family members and relatives ask me, "Hey doc, which test do I do to track my metabolic health and overall well-being?" These are the tests I usually recommend to them too. Hi, I'm Dr. Ameya Kai, a physician with specialization in sports medicine. In this video, I'll be talking about a few of these tests that I recommend to anyone who wants to have more insight into their metabolic health and overall well-being. These tests can even be used as a baseline before you start on your fitness journey or you get started on a new nutrition plan. That way you know where you stand as far as your blood levels are concerned. Keep in mind, these tests are just a small part of the annual blood test and checkup that you should be doing. Your doctor will give you more information about those tests. So in this video, I'll be talking about which test and a little bit about why you need to do these tests. I won't be going into detailed explanation as that video will be like hours and hours long. The best part is that you can get these tests done even if you're feeling fit and fine. Let's dive right in. It is also important to note, if you have any other specific symptoms, you need to get the other investigations done as prescribed by your doctor or specialist. Here are a few tests I have gone ahead and categorized them into 7 different panels. First up is the CBC, or the complete blood count. Then is the comprehensive metabolic panel. It is also called CMP, CMP14 or Chem14 depending on where you are from and which lab you get this test done. Third panel is what I like to call the sugar study. This includes HbA1c and HOMA-IR. Next, we have the iron panel, also called iron studies. Then we have the lipid profile or the lipid profile test. There are also a few vitamin tests that I recommend to all my patients. And lastly, we have the other important and optional tests. I have named these optional tests, but they are extremely useful to keep a track on your metabolic health. Why is CBC important in a metabolic test panel? Well, it is a comprehensive screening test that can help guide your doctor to diagnose a wide range of illnesses, including anemia, leukemia, bleeding disorders, and infections. It can also help find the cause of symptoms like weakness, fatigue, fever, swelling, pain, and bruising. It is an essential tool to keep a check on your overall health. Make sure all the parameters are included in your test. First and foremost is hemoglobin. Hemoglobin is a protein in your RBC that carries oxygen. We then have RBC indices or indices, and they should be included in the listed parameters. We then come to the differentials, TLC and DLC. Together, they give us an idea if there is any active infection in the body. Next up is platelet count, and lastly, we have ESR. ESR is the erythrocyte sedimentation rate, a test that can show if there is any inflammation in your body. This inflammation can be in a response to injury, infection, immune system disorders, or other blood conditions. Now, the comprehensive metabolic panel. 14 standard tests are included in this panel. Calcium. It is one of the most important minerals and is essential for proper functioning of muscles, nerves, and the heart. Next, we have sodium, potassium, carbon dioxide, and chloride, often referred to as electrolytes. These help with the balance of acids and bases in the body. Albumin and total proteins are usually to check if your liver and kidneys are functioning properly. ALP, ALT, and AST are enzymes that are made by your liver and are a part of the liver function test. BUN, or blood urea nitrogen, and creatinine are a part of kidney function tests and can provide important information about how well your kidneys are functioning. Coming to the sugar panel, first up we have HbA1c. It measures your average blood glucose level over the past 3 months. HbA1c is an important test to diagnose pre-diabetes and diabetes. Next up we have the HOMA-IR. I have a detailed long form video which I will link up here and also in the description. This is a very important test to check your insulin sensitivity. Do have a look at that video. Iron study test is an optional panel, but I recommend this in the annual checkup. So which tests should be included in this panel? The serum iron test measures the iron in your body. A ferritin test measures the amount of stored iron in your body. TIBC or total iron binding capacity is a test to measure how well your body transports iron. Transferrin saturation percentage is a calculation to find the percent of transferrin that is saturated with iron. Lipid profile tests or the lipid panel. It's a very important test as a general checkup as well as a part of your metabolic panel. You might have heard about the good cholesterol, bad cholesterol concept. Well, I am more interested about the triglycerides. Excess amount of triglycerides in the blood are associated with cardiovascular disease and pancreatic inflammation. So keep a close watch on triglycerides. Another most important test to include is the ApoB test, which measures the amount of apolipoprotein B in your blood. It is a protein involved in the metabolism of lipids. Super important test, vitamin B12 and vitamin D. Ideally, they should be checked every 6 months and a healthy level of these vitamins should be maintained. Coming to the last part of the recommended tests. Now, a few of these tests might be a bit expensive, but nevertheless, these tests are super important as they give good insights into your metabolic health. First, we have the thyroid profile. You may want to get all the 3 parameters in this test, which are the TSH, free T3 and free T4. Then we have the homocysteine test. The purpose of this test is to detect problems with the body's amino acid processing. Elevated homocysteine levels are associated with increased risk of heart disease and other medical conditions. The next test is DHEA sulfate, which stands for dehydroepiandrosterone sulfate. This test determines whether or not your adrenal glands are functioning properly. GGT, which is the gamma glutamyl transferase test. So GGT is an enzyme found in the body, specifically in the liver. GGT usually increases when there is damage to the liver or the bile duct. This test is important to check your health status of the liver. At some labs, it might also be included as a part of your liver function tests. Do check with your local diagnostic lab if this is included. If not, you can get this done as an extra test. Lastly, we have the high sensitivity CRP test. C-reactive protein is a biomarker for inflammation. This is an excellent test to track chronic inflammation. That rounds up the tests that I recommend for metabolic panel. Also, always remember to consult your doctor or medical practitioner for a diagnosis and treatment options available to you. I hope you found this video informative and useful. Please subscribe to my channel for more such informative content. Till then, stay healthy, stay safe, and see you in the next video.